How are you? Peace be upon you, all of you, Muslim, non-Muslim, within Peterborough, outside of Peterborough, and the world over. It's an absolute pleasure to be with you, to once again host a wonderful program today, the Body, Health and Mind Show, on my favourite day of the week, which is Wednesday. It's been a busy, busy week. How have you all been, by the way? I have heard some stories about Storm Aileen passing over Peterborough in the early hours of the morning, and there were reports of some slight damage occurring to cars, etc., and trees falling down. But I hope that you all stayed safe and went about your work and schools safely without any harm done to yourselves. Well, I definitely went into work. It was a good day at work. It was a refreshing day at work. Do what I love doing, which is being a doctor and seeing my patients. And who doesn't like doing that in our profession? Well, I've got a wonderful show for you today. And as you know, listeners, we have been having the past couple of shows with quite a few guests on. And today I thought, well, let's talk to you a little bit just about something a bit different. And up until a couple of weeks ago, I was racking my brains thinking, what is it that I'd really like to talk about? And I'll give you the background to today's show because I was actually looking on my Facebook page, actually, if I were to be quite honest. I'm quite active on Facebook. And I came across a video about a lady who was promoting awareness of a condition known as sepsis. And I watched this video with great intrigue and thought, do you know, it would be wonderful to do a show about this. And coincidentally, September happens to be Sepsis Awareness Month. And we're going to be talking all about sepsis in this week's show. And as usual, I would appreciate your company and participation. You're more than welcome to text and WhatsApp me on 07745 278 978, or come on in and call in the studio on 01733, which is the Peterborough code, 602 133. Or you can watch me on Facebook Live. We've got Facebook Live up and running today, which is wonderful, unlike last week. But the fact of the matter is, you're more than welcome to answer any questions of mine. I'll take a look at the questions in the break. And please call in. Do you know, brothers and sisters and listeners, what happened to me a couple of days ago? I got some people, I won't mention who it was, but obviously I had people listening to the show, and they recognised me straight away and said, oh, are you the doctor that does Salaam radio? And I said, yes, I do. And they said to me that they all listened to the radio, found it was very good. So thank you very much for your wonderful thoughts and positive feedback on the show. And they also said to me, we really do like listening. We really do want to call in, but sometimes you feel shy. So I just wanted to say to you, yes, I can understand, obviously, calling in, the facility's there for you. The health show is more about awareness about various conditions. And if there is a question niggling at the back of your mind that you really want to ask, pick up the phone and speak to me about it. And you know, whatever I do host on these shows, it doesn't really matter whether the question that you're asking or want to ask pertains to that week's particular show. You can call me and ask me about anything, really. And that also gave me an idea, and I was discussing this with our station manager, Brother Qasim, only just a couple of minutes ago, that I'd be quite encouraged to do what you call an open day show. And the open day show hopefully will comprise of, it's going to be an open day where you call in, ask me anything related to health, and I'll see if I can help you in the way of advice as much as I possibly can. So that's just a bit of food for thought. But it's wonderful to have your feedback. It's wonderful to be able to act on that feedback as well. So it's an open show. I'm talking about sepsis, but if you just want to call in and join the conversation about sepsis, you are more than welcome to. Otherwise, just call in and say hello. Tell me that you're listening to the show. It would be wonderful. And leave feedback on the end of the show. I'd be able to give some answers to your questions a little bit later on in the show. So, as you know, this show is going to be about sepsis. I have two particular people that I promised last week, and in all the nerve-wracking business of starting the show and there not being Facebook Live. I do apologize. I completely omitted to mention their names. And one is one of my listeners, Kieran Hanif. How are you doing? Hello, this is Dr. Shabina from the Body, Health and Mind Show. I hope that you're listening in. And the second little boy that I want to give a special mention to is Muhammad Ismail. And Muhammad Ismail is the most adorable young little boy that you would ever see. And he is one of my listeners. So I just wanted to say hello to you. And hopefully one day I can have you in the studio to have a little conversation with you. And he's a very stylish little boy as well. So these are two people that I just wanted to give a shout out to and dedicate the show to. And thank you very much for supporting and listening to Salaam Radio. In addition to that, I just wanted to remind you that the flu season is fast approaching. So make sure that you get those flu jabs. They have been launched. If you remember last week, Brother Ibrar, who was a pharmacist within Peterborough, had already said that they're rolling out their flu jabs at the end of this week. If you're eligible for the flu jab, please have your flu jab, because NHS England, I've just seen Public Health actually, has predicted that the flu season this year is going to be considerably more severe than last year, with a lot of waiting times at the hospital. So do make sure that you have your flu jab, because having the actual flu is actually a lot worse than the slight temperature that you can get after having the flu jab as well. So let me talk to you a little bit about sepsis and why I decided to do a show on sepsis. Now, in 2014, there was a little boy who was mentioned in the press by the name of William Mead, beautiful little boy, who died 17 days after his first birthday. And he died due to a condition known as sepsis. He had made numerous visits to his GP. Numerous calls had been made to the out-of-hours services, and unfortunately it wasn't recognised that he was suffering from sepsis. And by the time he reached hospital, unfortunately it was too late. And his mother, known as Melissa Mead, then set up a campaign to create awareness about sepsis and what it is. And the charity that actually promotes awareness of this condition is known as the UK National Sepsis Trust. So any information about sepsis can be received from there, but it was extremely heartening to see the story of this little boy. He was a beautiful little boy, and he had a whole future ahead of him that was cruelly taken away by this disease. And what sepsis actually is, it's very, very common, and we don't actually realise that sepsis is one of the biggest killers. It's one of the biggest killers of human life than a certain number of cancers put together. And what I'm going to be aiming to do in today's show is to make you aware of what sepsis is. We are going to talk a little bit about how a person feels, what causes it, and then we will go on, and at the end it's going to be a little segment for some of my professional colleagues that may be listening in, or if you're professionals within the field of nursing, etc., work at the hospital, to recognise the signs of sepsis, so that we can all be aware of this very, very cruel and very, very lethal, I would say, illness that does have a very, very high risk of death within the people that it affects. So if you want to join in the conversation, get on those phone lines and talk to me on 01733 602 133, or you can alternatively text and WhatsApp on 07745 278 978, or you can ask questions underneath the Facebook Live page. Now, sepsis is exactly what is it? It's actually a reaction within the body to a severe infection, and the infection can be anywhere in the body. It can involve the different parts, such as your throat. It can be a urinary tract infection. The infection can start off in the ears. It can start off in the chest. There has to be a place of infection, and then it is the body's massive reaction to this infection that is known as sepsis, in which a person rapidly deteriorates and in some cases may not survive, but the mortality rate is quite high. The causes of the infection could be either from a bacteria, from a virus, or even from a fungus. So it's very important to realize that. It's a medical emergency. So often like somebody having a heart attack. So I'm trying to keep it as simple as possible so that you're able to appreciate. It is a medical emergency. So just as the same as if somebody is having chest pain, if somebody does exhibit signs or shows signs of having deteriorating symptoms, which I will make you aware of a little later on, then that is classified as a medical emergency. Early treatment, and the earlier you get these patients into hospital, the more chances they have of surviving. So it is crucial to obtain medical help immediately. And I say that to those of you listening to the show who are patients, also to my professional colleagues who are listening to the show, who are doctors, GPs, doctors within the hospital setting, if you're junior doctors or if you're nursing colleagues or HCAs. Be aware that this is a very big killer and to appreciate or observe the signs of deterioration. You can hear that severe infection referred to as septicemia as well as sepsis. So you can use both terminologies. You can use sepsis and you can use septicemia as well. And strictly speaking, if we talk about it strictly, septicemia is an infection of the blood, whereas sepsis actually refers to the whole body as a whole. So the whole body is involved in sepsis, whereas septicemia is a reaction to the blood. Now, the germs involved, as we said before, are bacteria, viruses, or fungus. And if these bacteria multiply, they actually release poisonous materials known as toxins into the blood. And then this can cause serious illness because the body then gathers its immune defense system and attacks these toxins or poisonous substances with all its might. And this is where deterioration takes place in an individual. When we're talking about how common sepsis is, and these are figures that are taken from the National Sepsis Trust UK, about 1 in 500 people develop severe sepsis in England every single year, and the number is much, much higher in developing countries. So you can just think about that as a statistic, that 1 in 500 people develop severe sepsis every year that requires hospital admission. The number of people that contract sepsis on a general basis is much, much higher, but developing severe sepsis every year is 1 in 500. Who's at risk of sepsis? Now, I'm going to tell you a little bit about who's at risk of sepsis. The elderly, obviously, being more frail, especially those who are over 75 years of age, they're more prone to sepsis. So just be aware of that. If you have elderly, frail people within the household who fall unwell, who have a temperature, who become slightly confused, then it's probably time to seek medical help. And also the very young. So we're talking about less than 1 year old. Somebody who is less than 1 year old is also at increased risk of developing sepsis. The other people that are also at risk of developing sepsis are those who have had surgical procedures, and also those patients that have catheters for passing urine. If you've got a catheter that is a permanent catheter or an indwelling catheter, or it's changed every so often, then that also can cause infection. And catheters themselves, because they are essentially what you call foreign objects and foreign bodies, and they are inserted into a body cavity, they can also cause infection. People who drink alcohol excessively, because that also brings down the immune system and decreases the resistance to infection. And people who inject recreational drugs, they are also susceptible to developing sepsis. People who have diabetes, and it's a very well-known fact, and in my talks on diabetes, listeners, as you know, when I've done these talks on diabetes, that to treat a patient who has diabetes, an infection, is a lot more difficult as compared to somebody who doesn't have diabetes. So we have to be exceptionally careful of somebody who's developed diabetes and developed an infection, because it may mean that we have to treat them slightly more aggressively than someone who doesn't have diabetes. So that's one thing to keep in mind. Now, people who have had severe burns as well are at very high risk of developing infection, simply because of the fact that the area of skin that is burned causes dehydration. Obviously, there's a loss of body fluids and there is an imbalance of salts, or what we call electrolytes in medicine, and that can put you at increased risk of developing infections too. And often, very, very often, it's seen that people who are suffering from severe burns, who are in hospital, can often develop infections and have a very, very low threshold of developing infections too. People who have a very low immune system, so for example, if you have cancer and are on chemotherapy, and that does depress your immune system because they're known as immunosuppressive agents, they can also, you are at risk of sepsis as well as those people who have rheumatoid arthritis and are taking immunosuppressive drugs, for example, such as methotrexate and also other drugs known as sulfasalazine. Those can cause you to be at higher risk of sepsis too. And medications, having a high dose of steroids as well, can also depress the immune system and thus put you at risk of developing sepsis. Now, I don't know what the reasoning is behind this, listeners, but men are more likely than women to develop sepsis. And the death rate, however, is converse. So the death rate in women is much higher than it is in men. And the reason for this, we don't know it, but actually not a lot of medical research has been done in it. But men are more likely to develop sepsis. However, the death rate in women is much higher than men. Pregnant women as well, they're more at risk of developing sepsis. Obviously, when a growing baby or a growing fetus inside a woman's uterus is developing, then she's sharing all of her resources with her immune system. So that's one area as well that we need to be wary of as health professionals, that if a pregnant lady contracts an infection, we have to be very vigilant of what her vital signs are. Now, how do we actually develop sepsis? What can happen sometimes is when you, say, for example, develop a chest infection, and this is what happened to the little boy known as William Mead. When you develop a chest infection, and this is me just giving an example to you, a germ from that chest infection may overcome the body's immune system. So a bacteria, if you've got a chest infection due to a bacteria or virus, may overcome the body's immune system, resulting in sepsis. And unfortunately, not enough research has been done, or no research has revealed why this happens. There are only theories to establish why it may happen, and it's not clear why a few people are more prone to developing sepsis and serious illness, and many other people are carriers of the same germ, but they actually don't have any ill effect. And usually the germs that cause sepsis, usually the most common, are bacteria. But sometimes they can be viruses or fungi, which is obviously the plural of the word fungus. And studies suggest that the level of steroids in the body and the effects of various other chemicals and hormones and the way the body's cells handle the invading germs may be involved. But then again, it's a theory. So we've got a couple of things to think about here, listeners. If you've just joined the program, this is Dr. Shabina for the Body Health and Mind Show. I'm doing a program on sepsis. I would absolutely love for you to join in the conversation. So text and WhatsApp on 07745 278 978, or you can ring me on the studio telephone number 01733602133 and come on in and join the conversation. Ask me any questions you want to ask me. However controversial those questions may be about health, you can ask me. That's what I'm here for. This is what this show is for, to create more awareness. So how do we recognize it? So the symptoms of sepsis can be very vague, and this is why it's so important to create this awareness, especially in September, which is Sepsis Awareness Month, that I've already mentioned at the beginning of the show. And go straight to the hospital if you think someone close to you may have sepsis. Now, what are signs, symptoms? Again, symptoms are the sensations that you can actually feel as a patient, and signs are what others can see. So if you have somebody who's frail and elderly, or any of those group of patients that I've just spoken to you about that may be exhibiting signs of, or maybe exhibiting symptoms of feeling unwell, then it is your job as an outsider to look for those signs. And this is how I'm going to explain it. So not everyone's going to have these typical symptoms or signs. So example, people that have problems communicating, for example, the elderly or the very young who aren't verbal, won't be able to express how they feel. So symptoms are going to be very vague in that group, and that can make the diagnosis more difficult. What's the first thing? The first thing to try and recognize is the fact that you will have somebody who has suffered from some sort of infection. It might be a chest infection, it might be a cough, it might be a general cold, and your child or your relative or you yourself might be feeling poorly. And you might be feeling pain when you pass urine as well, which are signs of a urinary tract infection. You may feel unwell, and even if you've been taking antibiotic medication, and this is very important, listeners, even if you've been taking antibiotic medication, your infection can still rapidly worsen and you can still develop sepsis. The chances may be slightly decrease, but by taking antibiotics, be in no doubt that if you see anybody deteriorating despite taking antibiotics, it is something not to be ignored. Then what happens? A person later on may develop symptoms elsewhere in the body when the infection spreads. For example, meningitis, which is swelling of the tissues around the brain due to the infection spreading to the lining of the brain. You might develop kidney problems or even a liver condition. What is it that a person who is taking care of another person who is unwell might see if they think that they may have developed sepsis? Now, let's talk first about temperature. You might develop an unusually high temperature, a very, very high temperature, or a fever, or an unusually low one. And this is what happened to William Mead, the little boy. He had a very, very low core temperature, which was 35 point something. So that's not something to ignore. Hands and feet may become cold and clammy, even if you have a raised temperature. The heart rate may rise. The blood pressure may drop. And the breathing rate may be higher than normal. A person may become confused, not being able to speak to you properly. The person may develop blotching or mottling of the skin. And various blood tests might show inflammation in the body or problems with the working of organs such as the liver or kidneys. That is if you go to your doctor and the doctor chooses to test you. But do look out for these initial signs. So first of all, the temperature may be very high or very low. A person may have very, very cold or clammy hands. Or skin, for example, even though they've got a very high temperature, their skin might be very mottled, and also they could be confused and their heart rate would have increased very highly. And I know that you see a lot of these things in normal infections, but you can look at a person and say, that person looks very unwell. And one of the things that can tell you, along with that, along with the high temperature, is the fact that a person may be confused. And that's a very pertinent point, because somebody who has a temperature or an infection, say, of the chest or of the throat, you might have children who are quite jittery or children who are quite cranky. But one step further from that is when a child is exceptionally lethargic, exceptionally drowsy, exceptionally tired, not opening their eyes to take feeds, not responding to you, etc., in a confused state, restlessness, agitation. These are all the signs in children. And what I'm going to do for you after the break, listeners, is I am going to give you something too, for adults and for children as well. I'm going to describe something which is known as the adult safety net, which is the signs and symptoms to look out for in an adult, and in a child, what you should look out for as well. And I think that this is really important with the winter coming up, and obviously with the flu season coming up. I'm seeing more and more patients that are coming in with respiratory tract infections, and us as clinicians, it's very, very important that we take their temperature, their pulse, rather than just looking into the throat. It's very important that we take the temperature, pulse, and look at the rate of breathing as well, and have a general look at a patient when they walk through the door. So that's our responsibility. But we want to make you aware so that you know when to seek help from a doctor. So don't go away. Join me, Dr. Shabina, on the Body, Health and Mind show, and I'll be coming to you after a break.
You're listening to Salaam Radio, and it's now time for
This
Maghrib
Azan is sponsored by Sovereign Accountants. We offer support to help maximise your business potential and profits. Call us on 01733 567 111. Sovereign Accountants, where your success is our aim.
Allahu Akbar, Allahu Akbar. Allahu Akbar, Allahu Akbar. Ashhadu an la ilaha illa Allah. Ashhadu an la أشهد أن محمدًا رسول الله. أشهد أن محمدًا رسول الله. حي على الصلاة. حي على الصلاة. حي على الفلاح. حي على الفلاح. الله أكبر، الله أكبر. لا الله أكبر، الله أكبر، لا إله إلا الله. اللهم صل على محمد وعلى آل محمد كما صليت على إبراهيم وعلى آل إبراهيم، وبارك على محمد وعلى آل محمد كما باركت على إبراهيم وعلى آل إبراهيم في العالمين إنك حميد مجيد. اللهم رب هذه الدعوة التامة والصلاة القائمة آت محمدا الوسيلة والفضيلة وابعثه مقاما محمودا الذي وعدته. اللهم آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار. اللهم بك نحيا وبك نموت وإليك المصير. رضينا بالله ربا وبالإسلام دينا وبمحمد صلى الله عليه وسلم نبيا ورسولا.
This is Salaam Radio, Peterborough's Muslim. This is Salaam Radio, Peterborough's Muslim Community Radio, broadcasting on 106.2 FM and online.
Assalamu alaikum and welcome back. Assalamu alaikum, peace be upon you. What a wonderful show it is. And it's such a wonderful day today. It's Wednesday, my favourite day of the week. Your very own Dr. Shabina Asad-Qayyum, who is presenting this show on health issues to the very people of Peterborough and beyond, and internationally, and on Facebook, online, on 106.2 FM, and you can text and WhatsApp on 07745 278 978 and join in the conversation on sepsis, or you can call us in the studio telephone number on 01733 602 133. Come on, bring those calls in. I really do want to hear your opinion and also questions. I've just had a comment in, very nice program, thank you very much. It's from a brother who is listening to the show at the moment. And before the break, listeners, if you were listening to this show, it was all about trying to recognize the signs and symptoms of sepsis. And what I would like to do is I would like to add in a certain group of people who have learning disabilities as well, because if you remember, I was talking about the over 75s and the under 1-year-old small children who are unable to express how they feel, which are their symptoms. And this is the difference between symptoms and signs. You can feel, what you feel are your symptoms, and what others can see are the signs, or what others examine you for are the signs. So these are the two main things. And in that equation, I'm also going to put in people who have learning disabilities. So, for example, people who have global developmental delay, people who have disabilities, people on the autistic spectrum disorder. These group of children or adults will also not be aware of how to express their symptoms proportionately. Because do be aware that people who are, or patients that are on the autistic spectrum can either be one of two things: very, very sensitive to pain, or very, very numbing, or not able to express as much pain. So it all depends. So that is why it's very important to keep a lookout. And what I've done is I've developed something known as an adult and a child sepsis safety net. And if you've got a pen and paper handy, or you just save the show, and I distribute all of my shows onto the Body Health and Mind page, which is on Facebook, you can refer to the safety nets, which are both the adult safety net and the child safety net as well. And these are all those signs that you need to observe in a patient that would have had an infection and instead of getting better is otherwise deteriorating. So what to look out for when a person's unwell, or if you're unwell yourself, and this is in adults. You should seek medical advice immediately if you have a very high temperature. And when we're talking about very high, I'm talking about a temperature above 38.3 degrees Celsius, or a low body temperature, which is a temperature below 35.8. So feels very cold. So one or the other. If there is severe shivering, rigors, if there is fast breathing and feeling breathless, if an adult feels very sleepy or is about to lose consciousness, if a patient has severe muscle pain or tummy pain, if an adult feels confused or disorientated, which means not sure where you are. Are you in a room? Are you outside the house? Ask a person, where are you? Do you know where you are? And if they feel unsure or just confused, that is a sign you need to seek medical help immediately. If they have slurred speech, a bit like when somebody has a stroke, if they feel very dizzy or faint, or if they have a seizure or a fit, if skin is cold and clammy and either pale or patchy, which is known as a mottled skin type of appearance, and a rash, obviously, that doesn't fade with pressure. And listeners, you know that when I have hosted shows on meningitis, I've also made you aware of this type of non-blanching rash. And you can ascertain if a rash is non-blanching by using a glass and pressing it against the skin. And if it blanches out, then that means it's not a dangerous rash. But obviously, if it stays despite pressing the glass on the skin, that means you do need to contact a medical profession straight away. If a person's being sick and vomiting repeatedly, and also if an adult is not passing as much urine as normal, especially if a person has not passed any urine in the last 24 hours, that is a sign that immediate help must be sought. Now, if an adult has sepsis, they may also have other symptoms of infection, such as a flu-like illness, such as cough, fever, muscle aches and joint pains, or diarrhea and vomiting. An early treatment would save their life. Do remember, the key message to take away from today's show is the earlier treatment is sought, and the earlier such people are admitted into hospital, the greater their chances are of survival. Call 999 if you're very concerned, and don't think that you don't need to go straight to hospital. If there are any of those signs that I've told you about, do go to hospital. And if there is any delay in talking to a doctor, I know sometimes with the pressures on the NHS, you don't get to talk to your doctor. If you just see that somebody looks poorly, they just don't look right, call 999. Don't wait for your doctor to get back to you, or don't wait for the individual to get better. Don't take that chance. This is how devastating sepsis can be, okay? Don't become a statistic with that. Now, along with children, what we've done is, or what I've done is, I've drawn up a child sepsis safety net. And the thing with children is they're more vague than for adults, because children either will accentuate or exaggerate their symptoms because they've got a low threshold to pain. So even the slightest little pain will be very painful for them because they're only little and they don't have much reserve. And children with sepsis may feel abnormally cold to touch and have, again, like I said, patchy and mottled skin, or a bluish tinge to the skin, or may have very pale skin. And breathe more quickly than usual, be very tired and be very difficult to wake up from sleep. Young children might not want to feed at all, may repeatedly be vomiting, and that means repeated vomiting, or not pass any urine and not have any wet nappies. These are the signs and symptoms to look out for, listeners. And I'll tell you a story once. This was, and I always tell you stories, don't I, on my show, and I like that. But there was a time when I went to Pakistan with my eldest, Mariam, who is now started secondary school this year. She's as tall as me now. And she was little. She was a year old. And we went for my brother-in-law's wedding. And she woke up with a very, very high temperature. And as I'm communicating these signs and symptoms to you, I remember that during the course of the day, she became increasingly lethargic, her skin became mottled, and she had very, very cold peripheries. And I just looked at her and thought, no, there's something completely wrong. So over there, you've got the facility that you can take a child to an emergency doctor straight away. You have specialists there at your sort of at disposal, or accessibility is there. So I took her to a pediatrician who actually saw her, took some urine samples, etc., blood samples, and it was found that she had a viral infection, and she was what we call stable or hemodynamically stable. But we were very lucky that we were able to take her on time. And I can remember the severity of how ill she was. So you can just look at a child or look at an adult and think, there is something seriously wrong. I need to get medical help as soon as possible. You don't need to be a doctor to recognize those signs and symptoms. You don't need to have any medical knowledge. And in my child sepsis safety net, I'm going to tell you what signs to look out for. So remember, signs are those things that you can see. And you should seek medical advice immediately if you see these signs and symptoms. And if there is any delay in your doctor getting back to you, or you don't get an appointment, or the appointment is later on in the day, but your child is very poorly, just call 999. So a very high temperature, again, above 38.3 or 35.8, lower than that. Severe shivering again. Fast breathing or breathless. So if a child is breathing very fast and is breathless, a child is very sleepy or seems to be about to lose consciousness, just the same as when it was with adults. Again, if the child is old enough and brings their legs up and are crying in pain, that's often a sign that they have pain in their tummy. If they have a fit or a seizure, again, it is an indication to call 999 as soon as possible. Again, I've told you about the rash not fading and the glass test. Not eating any food or drinking any fluid, being sick and not passing as much urine, having dry nappies, again is a sign that a child is very unwell. Now, if the child does have sepsis, they may have other signs and symptoms of infection, such as a flu-like illness, such as cough, fever. They may be complaining that their legs hurt or their muscles hurt and joint pains, or even diarrhea and vomiting. And it's a life-threatening condition. I've already told you about William Mead, the little boy who died in 2014, as a result of which sepsis was made more aware to the public. And he was actually issued an apology from the Health Secretary, Jeremy Hunt, that the NHS and the health service had failed him. This is how important sepsis is. And the symptoms of sepsis, like I said, in children are vague. So you might not want to seek medical advice immediately, but don't sit on it. If your child looks unwell, they are unwell. And trust me, I have seen some very unwell children in my lifetime, and I've just looked at them when they've walked through the door, and my immediate instinct is get an ambulance and get this child into hospital. And those children are alive today and can vouch for the fact that actually my decision was right about them. Now, what I would say is, we've all established, and I know that I've communicated this to you, and I do a lot of repeating in my shows. And I'm just going to put in there, just before I move on, that if you have joined the show, this is Dr. Shabeen on the Body, Health and Mind show on Salaam Radio 106.2 FM in Peterborough and beyond. Text and WhatsApp on 07745278978, or join me on the studio telephone number 01733 602 133, or you can ask me a question on the Facebook page. So you become severely ill, it's become established already. You need to be admitted into hospital and will probably need to be admitted onto an intensive care unit. You might require oxygen in the windpipe. A patient might require oxygen in the windpipe if they're suffering from sepsis. And they may need fluids directly through a drip into a vein, which is probably in the arm, or with sepsis, because the circulation shuts down in children, sometimes that circulation is got to through the bone, in fact. And if pus is collected anywhere in the body, a surgical operation may be needed to drain it. Now, I often talk about this, which is the prognosis or the outlook, or what you call the better outcome of sepsis. What are the chances of survival if somebody who contracts sepsis? Now, the outlook for sepsis is good if it's diagnosed and treated early. However, with early treatment, between 10 and 50 people out of 100 will die depending upon the severity, and that's almost 50% of people. So between 10 and 50 people out of 100 will die. The older people have a better chance, especially if they have a long-term illness like diabetes or heart disease. So can you see the connection, listeners, that all of this talking about shows regarding diabetes, heart disease, etc., they have a link with the shows that I'm doing now. And if you look retrospectively, this is why it's so important to adopt good habits in your lifestyle, because it would decrease your risk of developing these, what you call comorbidities or heart disease and diabetes. And in turn, you're not put at increased risk of survival for something so devastating such as sepsis. And if I were to tell you a little bit about the complications of sepsis, you will be very, very surprised. So there is something which is known as DIC, which is the abbreviation for a condition known as disseminated intravascular coagulation, but you can just think of it as DIC. And it actually means that because of massive reaction to infection in your body, and you've been diagnosed with sepsis, it causes the formation of little blood clots in the small vessels throughout the body, so your body goes into complete shutdown. What then happens is you can get failure of the adrenal glands, and these are very important glands that sit on the top of your kidneys, and they produce adrenaline, which is one of the hormones which is responsible for running your heart rate and regulating your heart rate. And it also produces steroids and other important chemicals as well. You can be subject to, as a complication, multi-organ failure. And going back to little William Mead, this is what happened to him because his infection wasn't caught on time. He developed multi-organ failure. So several of the major organs of the body, including the kidneys, the liver, the heart, the lungs, these are all major organs that we actually can't live without. And these shut down at the same time. So this is known as multi-organ failure. And this is as a result of sepsis. And then you may develop something known as post-sepsis syndrome. And as with severe illness, which needs intensive treatment in hospital, people recovering from sepsis may experience physical and even psychological difficulties. We don't really stress much on the psychological difficulties, but yes, in this show, I feel that I do need to put that across, that you suffer from psychological difficulties, and these difficulties can then last for several years. So it's staggering what sepsis can actually do to an individual, even if you do survive. And physical problems, the long-term sepsis, which is called sepsis syndrome, the physical problems that an individual can experience are muscle weakness, just feeling extremely tired, short of breath, chest pains, body pains. You can get swelling in your extremities, including the ankles. You can get joint pains, you can suffer from a poor appetite, you can suffer from disturbed vision, skin numbness or pins and needles, and frequent illness caused by further infections. And trust me, listeners, I have sometimes, in some cases, seen amputation of limbs because of sepsis. And there are little children, and my heart goes out to them, who have suffered from sepsis, have fortunately survived. But because it's had such a ravaging attack and effect on them, some of their limbs have been amputated, which is very, very sad, that they start off as healthy, beautiful, bouncing babies, and for something as devastating as sepsis, if it was caught on time, is something that can be avoidable and treated. So we do have equal responsibility as health professionals, but you as patients also need to recognize that this is something that isn't right. And if you can't get to your doctor, get into A&E. And also have your immunizations and your flu jabs too, that build up the immunity. Can we prevent sepsis? So earlier on, when I spoke about the fact that good control of diabetes, good control of your cholesterol can lower your risk of heart disease and diabetes developing, or if you have established diabetes and heart disease, it can also prevent worsening of your condition. So that's the first mainstay in preventing it. But preventing specifically sepsis, again, my message is the same in every single show, listeners, that maintaining a healthy lifestyle reduces your chances of developing infections that can lead to sepsis. Both smoking and alcohol can increase your risk of developing sepsis too. So that's just one little thing to keep in mind. Now, I've spoken about immunizations. We had Brother Ibral last week on the Body Health and Mind shows of pharmacists, who spoke about the fact that they've launched the flu campaign, and it's very, very big within the United Kingdom. So if your surgery has sent you an invite and you are eligible for the flu jab, please go and have your flu jab. There are a lot of people that say that they get flu from the flu jab. Yes, sometimes you can get a minor illness from it, but that's because the virus becomes activated within the body. The flu jabs are made from an inactivated virus, and its immunity works because it gets into the body and then your immune system recognizes it and it then knows how to fight the flu. Some people do suffer from a little what you call a coryzal illness, but not to forget that the benefits outweigh the risk. And do remember that flu once upon a time was a massive killer within Europe. And I can't remember when the last epidemic of flu was, but it's a massive killer of people within Europe. And certainly we've seen the era of the swine flu, of bird flu in Southeast Asia. So please get your jabs done. And also make sure that you get your pneumonia immunization, because part of being at risk of developing sepsis is also having a chest infection and developing pneumonia, which brings your immunity down anyway. So pneumonia can be quite horrible to have, as you may know if you've ever had it. And children do need to be up to date with their vaccinations, particularly their H influenzae, their Group C, meningococcus, then pneumococcus and mumps. And with that, my dear listeners, this is everything that you needed to know about sepsis. And I'm quite glad actually that I've closed this topic, because I never get the chance to have a little bit of a conversation with you about other things that are happening on the radio station. And you know that Salaam Radio, being your very own radio station, does endorse and support a lot of charities. We are a very giving radio station. We are a very, very supportive radio station of worldly causes that are ongoing at the moment. And there are some events that I would like to promote and draw your attention to. And before I do that, I'd still like to say that I would be very welcome for you to ask questions to me, especially on the Facebook Live video. I will answer them later on today. Or if you have anything at all that you want to ask, I'd be more than happy to answer your questions. And like I said, later on, hopefully in the year, I can keep an open show in which you are free to call in, have a conversation with me, or if you just want to say hello, say hello. But winter is fast approaching, so be wary of the fact that, yes, all these infections are going to be coming on board. You have your winter vomiting virus, you have the flu, pneumonia can settle in, so do take care of those who are elderly and those who are little. Make sure you're washing your hands. Make sure when you sneeze, you catch it in a tissue and you cover your nose and mouth and then dispose of the tissue. But now, bringing you back to our events. On Saturday, the 16th of September at 2 p.m, which is this Saturday on Salaam Radio. Salaam Radio is going to be with Penny Appeal live. And this is going to be a fundraising event for the plight of the people in the Rakhine province of Rohingya. So this is for the Rohingya emergency appeal. It's going to take place this Saturday, 16th of September from 2 p.m. on Salaam Radio. Please donate. I'm going to give you the number, which is 01733 602 133 is the number if you want to make a donation to the destitute of the Rohingya people, and also those that are suffering and are fleeing their homeland in the thousands. And you can also email if you want more information on info@salamradio.co.uk. So please don't forget to join us on this live appeal on the 16th of September at 2 p.m. The people of Peterborough have never, ever let those people in need down. You are very generous and very charitable, and I know that you will have a wonderful exemplary turnout to help these poor people. So don't forget to do so. And if you want, you're more than welcome to donate on www.justgiving.com/Rohingya Salaam Radio. And it is on the Facebook page of Salaam Radio too. And the second event I'd like to bring to your attention is something, I'm going to be taking part in. Well, I shouldn't actually be saying that, because I give everybody their fair share of talk and telling offs if they don't exercise. So I'm going to be trying to set a good example with my colleagues who are in the sports show as well. As I understand, they will also be part of Team Orange, Penny Appeal, who will be the Great Eastern Runs, the Perkins Great Eastern Run. And this is going to take place on the 8th of October 2017. So those of us who will be running the half marathon will be running the half marathon. There are going to be some of us who will be running the fun run in my case. So please donate generously or support us with your cause. But having said that now, listeners, it's been wonderful to talk to you. I won't be here next week, but I promise to be here the week after. But in the meantime, stay tuned to Salaam Radio and the Body Health and Mind Show 106.2 FM.